We'll get started just so we have some time for the whole lecture and some questions at the end. So welcome everybody to Preventive Medicine Grand Rounds. Thanks for coming. I just ask that you please sign in. If you haven't, there's sign-in sheets on the end of each set of tables, and grab some lunch. Just a couple quick announcements. Next month, our Preventive Medicine Grand Rounds is actually sponsored by the Student Council, and it's in honor of National Public Health Week. The theme for the Monday of that week is Healthy from the Start. So we actually have a speaker that's coming from Denver Head Start. It's a clinical supervisor and mental health team lead, and they're going to talk about their coordinated care model, which is delivered in Head Start, and the impact of the model on families and children. So it should be interesting. But today I'm pleased to introduce our speaker, Dr. Keshia Pollack. She's an associate professor in the Department of Health Policy and Management at Johns Hopkins School, Bloomberg School of Public Health. She's a core faculty member of Johns Hopkins Center for Injury Research and Policy, where she also serves as the center's associate director for training and education. And her research involves the use of injury epidemiology, health policy, and health impact assessments to advance policies that create safe and healthy environments where people, particularly the most vulnerable, live, work, play, and travel. So we're excited to have her here, and welcome to Denver.
Thank you. Hi, good afternoon, everyone. Can everybody hear me okay? Okay, great. I'm happy to be here, especially since there's a snowstorm in Baltimore today. I have about 10 inches, so I got out right before it started, and I'll get home tomorrow after it's done, and hopefully somebody shovels my driveway while I'm gone. So thank you again for having me. Thank you, Carolyn, for inviting me to be here today. I'm getting over a cold, so I apologize for my voice. I'll try to talk as clearly as possible. And I'm also a New Yorker, so I talk pretty fast. I'm going to slow down a little bit. And if I need to slow down, just say, Keshia, slow down a little bit. So, and the recording, so I'm going to kind of hang out here. I usually walk around, but the mic is here, so I'll pretty much stand up here for our time today. So when I was thinking about what I wanted to talk about, I thought I would tell a story about the work that we're doing and that I'm leading and involved with in Baltimore and also up in New York City. We're designed to focus on the built environment. And I have a strong passion for health disparities, for inequalities, and thinking about what are the root causes of disparities. And so with that frame, we're going to talk today about inequities in the built environment and what it means for obesity prevention. Obesity prevention is a huge topic, as we all know. And in order to narrow my focus a bit in our time, in our about 40 minutes we have, I'm going to focus my comments on the physical activity side and thinking about opportunities that we create in environments for people to be active. And I have done some work on the food side, but I'm going to not talk about that today. All right, so we're going to, all right, that's not this little one, the wheel. Okay, there we go. Great, so in our time today, I'm going to just begin by making sure we're all on the same page and talking about what do we mean by inequities. I'm then going to talk about why inequities in the built environment matters for obesity prevention with, again, focus on physical activity, presenting some of the work that we've been doing in Baltimore, particularly related to pedestrian safety, walking school buses, and the built environment and changes that we've been working on with the New York City Department of Public Health. And then finally, I'm going to end with some potential solutions to just improve the built environment, and then there'll be plenty of time, hopefully, for questions and comments towards the end. So when we talk about inequities, I want to make sure we're all thinking the same thing. There's a lot of literature on health disparities. And if you actually were to look in the dictionary, most dictionaries define a disparity as an inequality, some difference most often by age, gender, race, ethnicity. And most times, disparities and differences are very synonymous in many settings. The discourse on disparities has actually evolved over time to talk about inequalities. And really there's a lot of literature in health services research world where it talks about unequal treatment, and folks have read that IOM report, and thinking about lack of equality as an opportunity, again, talking about treatment or access to care and status. In recent years, there's been a push to help think about inequity. And by inequities, we mean thinking of unfairness, injustice, some root causes of some difference. And why this matters for me in my work is that if you look at the World Health Organization, their report on the social determinants of health in 2008 talked about inequities. And they said that it's the inequities in where people live, grow, work, learn, and play. That's what has led to disparities in this country and in this world. And we know that at the root cause of those inequities are those conditions by which we are living are informed by political context, social context, economic forces. So if we're thinking about the root causes of social determinants of health, we're talking about things such as institutional racism. We're talking about economic inequalities. We're talking about inequalities in job opportunities. And when we think about, again, health and what matters for health, this is also from that World Health Organization Commission, this framework, which says social determinants of health matter. And if we think about health, across the bottom in green, not only are we working within a socio-ecologic framework, but we are also thinking about how inequities influence every aspect of that level. And so we think about public structures and public services and infrastructures, for example, and the fact that certain communities have more resources than other communities. The fact that social, economic, and political factors such as segregation and inequality are very important for where people live, work, play, and health outcomes that arise from that. And you can find this figure if you're interested in replicating it or using it in some facet on the World Health Organization's website. So it's in this context that I approach my work in terms of the built environment and health. And I want to just define the built environment so we're all talking about the same thing. We're really talking about the human-made environment. So think about things such as buildings, roads, parks, restaurants, grocery stores, other amenities. And so this is an example of a built environment. You have a nice running trail. You have lots of green spaces along the roads where people can go out and be active outside. This is also the built environment where we have very little green space, a lot of concrete buildings, and you see that there's just actually that little bit of green right in the middle of the screen where we have a little bit of green space. But otherwise, this is the context by which some people are living. And finally, this is the built environment. If you live in a community, there are certain communities, I can think about neighborhoods in Baltimore that have an overabundance of liquor outlets. And so we have particular communities that might have more access to services, if we want to call them that, such as a liquor store outlet. So all of these decisions that go into where places, where parks or liquor stores or other amenities are placed relate to the built environment. And we know that if we think of the built environment, there's an abundance of literature that shows that the built environment, that neighborhoods, that where we live matter for health. And these are just a few of some key summaries. And the Robert Wood Johnson Foundation had a commission they put together on social determinants of health, and they've put out a series of reports that highlight how do we connect education to health, housing to health. And these are some of the findings that are in their comprehensive report that they came out with. So we know that children who live in low-income communities are more likely to be exposed to pollutants that might lead to asthma. We know that low-income neighborhoods are less likely to have access to parks and public places and safe places for people to play. And we also know that low-income communities are less likely to have opportunities for people to seek jobs and good schools by which they can provide a path for them and their families out of poverty. We also know that violence in schools and on the street exposes kids to levels of anxiety and other types of poor outcomes that can manifest over the life course. And also, I mentioned alcohol outlets a little bit earlier. We know that research supports associations between the concentration of alcohol outlets, poverty, and crime. Again, all of these neighborhood factors can be traced back to decisions that are being made related to our built environments. I'm going to tell you now, go through a few papers or some research that we're doing that actually looks at this a little bit more. This is a paper that was published in Health Affairs a couple of years ago that I worked on with my mentor, Thomas Levis, who's an expert in health disparities and has really tried to understand how do we tease apart what I'm talking about? How do we tease apart the fact that neighborhoods matter, that the environment matters for where people live? And so we went ahead and looked at some disparities in a particular neighborhood in Southwest Baltimore. And we sought to explore, well, what happens when you have blacks and whites who live in the same community? Right? And so you think about all of the national data sources that highlight disparities by race and ethnicity. And we know there's a lot of confounding there by socioeconomic status. So elements such as income, education, that might actually confound these disparities that we're seeing. So Thomas said, well, let's think of what happens when we're talking about everybody who's sort of equal in the same community, equal in quotes in terms of their socioeconomic status. And we entitled this paper, Place Not Race, and this is what I want to focus on in terms of this finding. And in terms of the methods, I want to tell you what we did. We looked at 2 contiguous tracts in Southwest Baltimore that was at least 35% African American and white residents. They were fairly equal ratios for blacks to whites for median income and graduation rate. So taking account of those aspects of socioeconomic status that have often been implicated in causing these disparities. And overall, we were able to say that blacks and whites in the same community were exposed to the same set of SES factors, the same social conditions, and the same environmental conditions. We did in-person data collection using valid measures from existing surveys, and we compared these findings to several national data sources. So the National Health Interview Survey, the NHANES, and the MEPS, which is a database of healthcare access, basically. And what we found actually was pretty amazing, that racial disparities that we see in national samples were attenuated or completely erased in this community. So we saw that the disparities that we would see nationally for diabetes, for obesity, for use of health services were all eliminated. The only disparity that remained was smoking, where whites continue to have a higher prevalence of smoking than blacks. And what we concluded from this is that if we were actually to look at people in the same community, blacks and whites, that those significant disparities that we see are attenuated or eliminated, really highlighting the fact that where you live matters. The communities that you live matter. Place matters. And why this is important for policy recommendations is that if we want to focus on place, we need to think back to what I talked about earlier at the beginning, those inequities, because we know that race also determines place. We know that policies or practices related to, example, institutional racism might limit where people are actually able to live because of lending practices. It's been heavily documented. And so if we're trying to have a focus on place in the environment and what that means, we need to think about the fact that we have inequities at those root causes and policies need to address those inequities. So that was just a little bit of a foundation to talk about how I approach my work, and I'm going to turn to obesity prevention for the rest of the time today. This is a very simplistic figure that just highlights when we think about obesity, we're looking for sort of that energy balance, calories in versus calories out. And again, very simple, but we know there's a lot of context around this. We know that there are factors that influence what's on the left side, my left, in terms of the calories in. We know in terms of access to food and beverages that there are several neighborhood level factors that influence that, and also on the calories outside. We know that physical activity, opportunities for physical activity are tied to where people live. And so I'm going to focus on this for the rest of our time today and help people to help all of us to sort of think through what this means as those of us focus on trying to improve the public's health. So I take an environmental focus to my work, and this is a figure that I continue to use. It was developed in 1999 from the International Obesity Task Force. And one of my mentors, Shariki Kumayika, was one of the authors of this diagram. And basically it talks about for obesity, at the population level, there are all these factors that inform whether or not the population has high levels of obesity or even underweight, if we think about both sides of the nutritional outcome. And so for the work that I look at, if we focus on over here in the energy expenditure and the food intake, I like to think about, well, what do we know about the environment and how it influences what people eat, but also influences how people are actually able to be active. And again, as I said earlier, I'm going to focus on this activity part, but I put up this conceptual model here to show everyone that policies and programs at the national level, related to transportation, related to education, also at the community level, and at the work and the school and the home environment, all influence the expression of obesity. Many scholars have talked about an obesogenic environment and about how obesity is really a natural response to a really unnatural environment. And if we think about what that means, how do we actually try to get at the environment to create opportunities where people can be more active and can be active safely? I'm not going to show those obesity maps. Everybody has seen them 100 times, and I'm just going to show this one. This is the most recent maps that have come out from the CDC that is showing the prevalence of obesity amongst adults. This is from the Behavioral Risk Factor Surveillance Survey from 2012. And this map shows increasingly in the darker colors the prevalence of obesity. So for the places that are orange, we're talking about 30 to 35% of the adults are obese. And the lighter colors are the lowest prevalence of 15 to 20%. So I wanted to just ask a little participation in terms of folks looking at the states that are lighter. What state do you believe has the lowest prevalence of adult obesity in this country? Colorado, absolutely. And what about the highest? Mississippi, that's a good guess. It's close. It was until recently. I'm sorry? Louisiana, absolutely. Louisiana has the highest prevalence of adult obesity. It was Mississippi for a while, and now Louisiana has that distinction of having the highest current prevalent adult obesity prevalence in the country. And I just wanted to show this to show the significant disparity in this country in terms of geography, right? So folks in Colorado here where we are, the prevalence of adult obesity is about 21%, all the way to down in the south in Louisiana, almost 35% of adults are obese. And if you think about the work that's going on in those areas, they're really trying to focus on the environment. How do we create opportunities for people to be safe, to engage in physical activity, safe physical activity in terms of sidewalks, in terms of walking behavior, in terms of access to facilities. And they're also focusing on how do we change the nutrition environment, the food environment for people in certain communities. So as somebody who does work in physical activity and promoting safe physical activity, I think we all can recognize as public health folks that there are extreme benefits to physical activity beyond just controlling weight. We know that people who are physically active live longer. They have lower risk for heart disease, stroke, type 2 diabetes, depression, and even some cancers. We know that there are social benefits to being physically active. We know that there are also psychological benefits. And so overall, we can say that being active is good for one's health. That being said, we know that the prevalence of people who are physically inactive in this country is very high. And we know that physical inactivity is one of the 5 preventable causes of death in this country. And so if we were to look at this map, again, we see that the prevalence of adults who are physically inactive is very low in places like Colorado, and again, continues to be very high in places like Louisiana, Mississippi. I remember when I first took public health, we talked about the stroke belt and thinking about the southeast part of the country and what's happening there in terms of the environment, in terms of culture. And we still seem to see these significant disparities by geography. Again, just wanted to show this to you to say that we still have a long way to go. Clearly, people aren't meeting the levels of minimum levels of what's recommended for physical activity, but I'm more alarmed by the people who are not active at all. I think that for a health risk factor is really significant. We want everybody to increase their levels, and I think it's important that people aren't meeting the minimum requirements put forth by the government. But for people who are sedentary, we're talking about other risks that matter. Going back to where we began our story today in terms of the neighborhood and the built environment, we know that communities can help promote physical activity. And this is a great schematic that I really love that was developed by Active Living Research. And Active Living Research is a national program of the Robert Wood Johnson Foundation. And this is one of their infographics that they started to develop. Actually, the national conference is next week in San Diego. Where people get together from a variety of sectors, and so public health, transportation, planning, to come think about how can we create communities that are going to promote physical activity. And this schematic just summarizes some of the leading literature in this area. So, for example, there's a box here about trails. We know that people who live near trails are 50% more likely to meet the physical activity guidelines because they have access to a place where they can be active. That being said, we know that trails need to be maintained. We know that they need to be safe, and so we need to think about that as well. We also know that people who live in walkable communities are 2 times as likely to get enough physical activity as those who don't. So we know living in a community where you're able to walk safely, where you have access to sidewalks, where you have access to well-lighted communities and streets at nighttime, those things matter for health and for people being active. We know that teens who live in poor or mostly minority neighborhoods are 50% less likely to have access to a recreational facility near their home. Again, that gets back to those inequities we talked about earlier, where certain communities in this country have more access to certain resources than others. And we also know in terms of joint use agreements, which are the abilities for a community to have a policy or a practice in place by which they can access the facilities of a school, for example, after school. We know that kids who live in those areas are 84% more likely to be physically active when the schoolyards are kept open after school for public play. So we're saying, let's not just close the doors and lock the gates when kids leave school, but can we leave the gates open so kids can come in and have a safe place to play after hours? When I first came into the world of active living research, I was coming from the perspective of an injury epidemiologist and thinking about the fact that our colleagues in obesity prevention were always suggesting, well, go be physically active, go outside, go walk, go use the playgrounds, when we know that oftentimes those environments are not safe to allow folks to do so. So that's the perspective by which I came to the obesity debate. And I think that this statement here from Active Living Research really speaks well as to what the problem is and why we are moving forward with thinking of the built environment to promote safe activity. And what they say here, I just want to highlight the second part of this, is where they say, unfortunately, many people, especially those who are at high risk for obesity, live in communities that lack parks, have high crime rates, dangerous traffic patterns, and unsafe sidewalks. And I'll tell you that what I want to say is that these are equity issues that we talked about earlier. These are the same issues we talked about by which certain communities have access, certain communities are disproportionately affected by certain types of structures and policies and programs that limit their ability to access safe opportunities for physical activity. And why this matters is that we know walking is the #1 aerobic exercise for people. We know people can walk for free if you live in a community where you can go outside and walk. We know that 145 million adults in this country now include walking as part of how they get their physical activity daily. People walk for fun, for relaxation. Walking the dog is a great form of exercise as well. And we know that people are walking more often. That being said, we also know that people are walking in neighborhoods like this with no sidewalk. We know that people, again, are walking in the streets because there's no access, so there's no way of having a safe pedestrian area on the streets to walk. And we know that some people who are in mobilized transportation, such as wheelchairs, I see this all the time in Baltimore, that folks are riding down the street with their motorized wheelchair in the street right along next to vehicles. So as we think about what we are doing to help promote physical activity, we need to think about the various users of the road and that do people have safe ways to walk from point A to point B. This is a great report called Dangerous by Design that talks about how do we solve the epidemic of preventable pedestrian deaths. And in this report, it goes through these examples and highlights the issue of pedestrian injuries in terms of people who've been killed or injured. And in this report, they highlight that we know how to prevent these injuries. We know how to create safer environments. We know about the benefits of having sidewalks. We know about the benefits of environmental changes, engineering changes, education changes by which we can reduce pedestrian injury risk. In Baltimore, we've actually been doing a lot of work in this area. The university president in 2011 identified pedestrian injury as a problem in the community, and mostly because parents were dropping their kids off in Baltimore saying, we're turning our kids over to you to start school. And there were a series of incidences where a few college students were hit, 2 died. Relation to a pedestrian fatality, and one was a bicycle fatality, and there were a few non-fatal incidents. After that happened, the president charged the provost of the university to do something about this, and the provost called our injury center to say, can you help us understand what's going on and solutions that would be effective to reduce this issue? So we embarked on some research to try to measure the problem. We conducted environmental audits in the neighborhood. We conducted focus groups. We had existing data to try to measure the problem, particularly in this community. And we found that there were hazardous intersections. There was a lot of jaywalking. And the biggest thing that we found that the university didn't really appreciate is that so much of the focus on safety was about crime prevention. So all the messages were about walking safely to avoid being robbed or to avoid something else, when there was not as much attention to traffic safety. And so the students were coming in, particularly many of them who had not lived in an urban environment before, who were not aware of the traffic risks that needed to be considered in this particular community. So we generated recommendations along the 3 E's, so education, engineering, and enforcement, to try to address these issues. And as a result, the university actually has increased the enforcement in this area, and there's actually a dedicated traffic safety officer that's there at peak times of the day to help direct traffic. There was a particular light that was misaligned with the pedestrian crossing. So how many times does the light turn green and cars are turning at the same time people are instructed to cross the street? So we actually we worked with the city and had that light change. So now there's a delay, and there's a dedicated green arrow by which people have enough time to cross the street before that. I will say that one change took a lot of work. The transportation engineers pushed back a ton and said, this is going to slow down the traffic. It's going to cause a traffic jam on a major intersection. But it took a lot of time and perseverance by which we were able to actually have that light put in over there. And we actually wrote up this paper with some lessons, which is in press at Injury Epidemiology, if folks are interested in learning more about our work. Another thing that came out of this work is this, in an effort to address the education side, is the communications people at Johns Hopkins developed this campaign called the Rhodes Scholar Campaign, taking our evidence that we found, the perspectives from the focus groups, and developed this campaign. And what you'll see in the image are all these yellow shoes. So what they did actually is they asked for a call for people to donate shoes, old shoes, that they spray painted yellow to indicate caution. And actually they were put up around that major intersection in Baltimore. And so actually they had 3,000 pairs of shoes that were donated by students, all painted, and then they were tied up on that fence. And again, just to help people be more aware of this issue. I think people oftentimes drive down the street, they walk, and they're not really aware that this is right where that fence is at a major intersection where most of the fatalities and the non-fatal incidents occurred. And so this was one of the ways that the communications department felt that they could address that education E of the issue in terms of the 3 E's that we want to address. We are evaluating this effort and have done some follow-up work to look at changes in knowledge, attitudes, and behaviors amongst the students in response to the Rhodes Scholar Campaign, and that work is still ongoing. We did such a good job there. The president said, well, can you deal with the other campus? And so we have, we're working now in East Baltimore, where my office is on the medical campus. Also, again, a major issue in terms of pedestrian risk. And the challenge there is that we actually have had several pedestrians hit in the crosswalk. So they're in the crosswalk, they're doing what they're supposed to be doing, and there were many left-hand turns. So the cars are turning left, and they are focused on getting to the parking garage, which is soon as on the right side, as soon as you turn left. And there were several incidences where people were hit at this one intersection. So again, we were asked to look at this issue a bit more and to focus on doing something is what the provost charged us to do. We collected all the data that we could. We actually also collected data from video data from Hopkins Security, because they actually do have videos of certain areas just for crime prevention. And so we actually saw several of these instances they were recorded. So we were able to dissect what happened. We also collected other data from the state and from the city. And then we also videotaped at high risk intersections during peak times. So we actually set up cameras around the community. You can imagine this with the IRB, right? And so we have cameras around, and for certain periods of time, it's just rolling film, and we're able to actually code that to look at pedestrian behavior. And it's actually amazing when you see people who are doing everything you can imagine, and cars as well, not paying attention, not stopping when they need to stop, people darting across the street. And the traffic laws are pretty clear about jaywalking, and it's not enforced in Baltimore. But we wanted to figure out, well, how could we try to change the environment and or increase awareness to address this issue? We conducted an online survey also and did focus groups, and we actually had about 3,800 people respond to our survey to try to, again, get at these knowledge, attitudes, and behaviors. And I just wanted to show a few insights from the survey. people are pretty familiar with pedestrian safety issues. They know what they need to be doing. I mean, that was clear. They also said that the issue of pedestrian safety is an important problem that we needed to try to look at a bit more, because it's your opinion about it matters. If you think that you're going to get hit, then you might be more aware. For the people who were less likely to think of that they were at risk, they weren't really going to be as aware too much. They also perceived that there was a shared responsibility between drivers and pedestrians to help deal with this issue. And while we asked about law enforcement, they thought it would be a particularly effective solution, although developing a campaign was in the top 5 in terms of what we can do about this issue. So again, embracing a 3E perspective, we went ahead and we talked to law enforcement and said, can we increase enforcement here? And they said, there's no way. In Baltimore, the focus is on crime prevention, on homicides. We're not going to do much more in your area to try to address traffic safety issues related to pedestrians. I mean, it was a fact at the time. Although they did say that they also didn't want, they cautioned us from being viewed by the community as an institution that was cracking down on jaywalking and giving people tickets. We also looked and worked with the city on some engineering changes. That intersection I mentioned with that left turn, we were able to put in an arrow, a delay, so now people are able to cross. Although it's only a 5-second delay, we couldn't get much more than that. But there are also traffic safety officers there that Hopkins has invested in to help during peak times. We ended up focusing our efforts on developing this campaign, which the school really wanted us to do to help increase awareness. And in doing that, we worked with some other partners. We looked at other areas which are doing some work in this area, including Baltimore Metropolitan Council, the University of North Carolina at Chapel Hill has had a big project on pedestrian safety in that area, and also the DC Department of Transportation. And we reviewed their materials, and we hired a communications consultant who worked with us and developed these messages with a variety of creatives. And ultimately, the messages that resonated most with people was this message about alertness. So how can we remind people to be safe, be seen, to not get hurt? And ultimately, this is what we came up with. And this is the campaign that's actually just rolled out, had a soft launch about a week ago, and there's a big rally tomorrow. And we have actually inundated the area around Hopkins with these creatives. And we have this on banners, on street signs, on we've given giveaways. And again, the message is, how do we remind people about what they need to do, which is what we heard from the research. The State Department of State Highway Safety Office was very excited for this work because they have been putting out campaigns for a long time that did not have the evidence base. And so what we were able to do is define the problem, identify solutions, and come up with a way that we can therefore address the environment to try to improve pedestrian safety. Related to that work, I've been doing work in terms of kids walking to school, so partnered with the Baltimore City Department of Transportation, the Safe Routes to School program, and we did some research looking at kids in Baltimore and their walking to school behavior. And there's a couple citations are on the bottom regarding this work that I was on PI on. And we found that kids in Baltimore are walking to school most times, right? So again, here they are walking in the same environments by which the adults that we've been studying have had in high-risk situations with vehicles. But one of the things we wanted to do here is we wanted to understand, what do kids think about the neighborhood? And so we found that most of them have low perceived levels of safety. So they don't feel very safe when they're walking to and from school. And that related to traffic concerns about crime and gangs. But we also found out that a lot of these families don't have cars. So the kids have to walk, or they're taking the city buses. So knowing that kids are having to walk, knowing that kids are living in neighborhoods with a lot of incivilities and they're having to walk anyway, they have low perceived safety, what can we do to help try to improve that walking experience? And so we've been working with the city to implement walking school buses. How many people are familiar with walking school buses? Yeah, so walking school buses can be very formal and informal, but basically it's kids walking together with a couple of adults, and the ones that we've been setting up have actually been formal, and there's formal bus stops along the way where kids can actually stop, meet, their parents take them to the stop, the walking school bus comes, picks up the kids, and they continue walking. This has proven to be very effective in areas by which kids live within about a mile or so from school. Do you have a question?
I do, yeah.
Yeah.
Could you just define incivilities for us?
Sure, I'm sorry. So incivilities for this particular study was defined as physical disorder and social disorder. So we looked at neighborhoods in terms of abandoned homes, drug paraphernalia on the streets, crime, drugs, several things, trash on the streets. And you can look at the papers for the methods about this, but we worked with a colleague who developed a tool called the NIFTY. And the NIFTY is a neighborhood assessment tool. And there are people that were trained to go out and objectively assess every block in Baltimore. And so we were able to link that data with the kid data to measure the built environment where kids lived and the paths actually that they walked to school. So we see what they're experiencing between when they walk from home to school. So thank you for that. I apologize for not making that clear. So in terms of the walking school buses, I wanted to just say that we were able to get some funding from Active Living Research to develop a guide by which principals can develop walking school buses in their school. And so we put this together. We had several meetings with principals and vice principals. I went to way more parent-teacher nights than I would have ever thought, and I don't have any children. But I spent a lot of evenings going around to schools to develop those partnerships and to set up meetings by which we get principals on board with developing the walking school buses. I'll say the two challenges about walking school buses in Baltimore were, one, related to volunteers. Believe it or not, we had to have not even just willingness, but even the people who were willing to participate in the walking school buses, many of them did not pass the background checks. So when you think about what that means for somebody who has a criminal history, how do you implement a program like this in an urban neighborhood where you don't have a significant number of adults who are able to be involved? The other challenge that came up is that principals were really on board with this concept, but they wanted to know how would this program affect their absenteeism rates. So in the city, absenteeism is a huge problem, particularly chronic absenteeism with children. And so the principals wanted data that shows, well, if a kid participates in a walking school bus, will they get there on time? And part of the reason that chronic absenteeism is a problem is a lot of kids are walking their younger siblings to school. Their parents are out at work or a single parent household or guardian, and then they're coming to school late after that. And so we didn't have that data at the time to look at that, but since then we've been working with them to try to measure how this program is being implemented and the impacts on things such as tardiness and walking to, and kids getting to school on time, and also kids' participation in these walking school buses. It's been very challenging, a very slow process, but I'll tell you, very rewarding for me to work with the health department to be involved in this project. And this, again, is a toolkit we developed that we've widely disseminated to policymakers and to folks at the Department of Education and to principals throughout the city. The final thing I'm going to share with you today is the work we've been doing, again, on the same area of the built environment, and this is with the New York City Department of Health. The New York City Department of Health, back in 2010, developed the Active Design Guidelines, which are a way to help engineers and architects and planners think about building physical activity and health into design. And there are specific strategies for urban design and for building design. And this is just a summary of what's included in there. So they're focusing on urban design strategies for neighborhoods, outdoor spaces, recreation, and building design strategies related to where do we place stairs and elevators. And this document has been highly successful. Over 15,000 copies have been actually distributed or downloaded, really heavy outreach to architects. And we became aware of this a few years ago where some colleagues said, well, this is great, and it's great that this is being so widely disseminated, but what about injury? What do we know about how we can do these things safely? Right? So thinking back to what I said about safe physical activity, and so with support from the National Center for Injury Prevention at the CDC, we actually developed a supplement to that document called Promoting Safety. And in Promoting Safety, we partnered with the Society for Public Health Education and the New York City Department of Health, and we have this guide, this book that we've developed that talks about the main strategies from the New York City Department of Health document, Active Design Guidelines, and connecting it to how do we build safety into this. So there's an example. Here's how we approach this. So we looked at the document. We did some formative work to talk about how we actually frame and develop this. And I'll say folks were really turned off by the phrase injury prevention, but they were really enthusiastic about promoting safety. So that's even one framing that we actually had to implement this because we knew our partners would not review it actually or read it or even look at it if it wasn't framed in the right way. We looked at all the strategies from the active design guidelines, and we identified 18 of them that we could identify literature that spoke to injury prevention in the urban environment, and 9 of them in the building environment. We did a systematic literature review when we rated the strength of the evidence. And the document was peer reviewed by several agencies, including the Department of Transportation in New York City, the CDC, the Department for Disabilities in New York City Planning. Several stakeholders reviewed the document in the peer review process. And this is just an example of what one of these pages look like. So we have this particular strategy around lighting, and we say which active design guidelines it was applicable to. And we know that there's literature about lighting, right? So lighting is good. Lighting makes sense. And in the document, actually, it didn't talk about the active design guidelines talked about how you need to have well-lit stairs, for example. But there is actually an injury-based literature about why adequate lighting is good for preventing falls, particularly among the elderly. So we summarized that information. We also talked about how workplaces with bright lights are less likely to experience homicides and crimes. And we pulled that together. And we have summaries for each of these strategies that I just mentioned. And we're putting this together so that people can see when you're implementing a strategy such as lighting, you can think about the added benefits of reducing injury. We did something similar for stairs, right? So we know that the active design guidelines talked about positioning stairs in the middle when you walk in so people are less likely to go to the elevator. But we know that there are ways to design stairs to reduce the risk of falls. So that's what we brought to this document. So as this document is being shared widely, we're also sharing it with the same target group so that planners and architects can help think about building in injury and injury concepts into the designs. And this work, actually, we made 3 conclusions that were not surprising at all, but that it was clear that these active design strategies are very, very compatible with injury prevention principles. I mean, it just makes sense that we're talking about the two together. We also were able to show that the injury prevention strategies have multiple benefits. And so, for example, if we have traffic calming measures are benefiting multiple road users, which the transportation engineers really liked. And we also identified, again, we just need more research for some of these strategies. So, for example, at the time when we did this, we saw that, red light cameras have the ability to reduce motor vehicle crashes in some communities, but there wasn't data specific to pedestrians and bicyclists. And that's what they were asking us for. Well, what do we know about other road users if we put in a red light camera in the community? So definitely areas for more research are out there. We were really excited that the American Institute of Architects for New York wrote the introduction to the report. Architects are a key dissemination group that we are reaching out to. And it was the president and the executive director wrote this at the beginning. Again, just supporting, promoting safety and promoting the fact that architects can help think about these issues in the work that they're doing. We have been widely disseminating this. The report was released at the end of 2012. We had 4,000 copies printed, and we have an online dissemination as well. And we've just been going around presenting the various aspects. So architects, planners, transportation engineers. I have a presentation next week at Active Living Research on this work. And we were actually invited to write a paper about this promoting safety document for a special issue sponsored by Active Living Research of Preventive Medicine, which will come out at the end of the year. So as I want to just sort of wrap up in terms of thinking about the built environment to promote health, and as we think about obesity prevention and think about the physical activity and why we want people to be active and promoting safe physical activity, we know that the evidence supports a focus on walkable and bikeable neighborhoods, having really sustainable and accessible public transit, parks, recreation facilities, and open spaces that people can use, safety and equity, and of course the healthy food environment, which I didn't talk about today. And so you might be saying, what do we do about it? We actually can go back to what we talked about earlier, which is the social determinants of health, thinking about addressing those social determinants of health that relate to the built environment to try to increase opportunities for physical activity. And again, I embrace the socio-ecological model by which we can think of the various layers by which somebody's individual behavior is influenced, focusing on the community, on the broader policies and programs that work at the macro level. And we know that there are some examples of policies and programs that make a difference. So, for example, for transportation, complete streets policies by which communities around the country are implementing or adopting a complete streets framework by which all road users are thought about in the planning and redesign of roads. We can think about opportunities when planning departments are putting forward their pedestrian and bicycle master plans. I'm a strong supporter of safe routes to school, by which they are making changes to the environment as well as educating kids on safe walking. And they're also doing a lot of work on biking as well. And also, I think that we can think about ways to shift or advocate for funding to support non-motorized transportation. So what are we doing in communities to support pedestrian and bicycle behavior, to support other opportunities for transit? In the recreation world, we know that increasing access to quality parks, playgrounds, and trails matter. So how can we think there about trying to make inroads and making sure people have access to these places to be active? We know that the location and quality varies. So again, thinking about inequities in communities, what can we do to try to shore up those communities by which quality of parks or playgrounds might be deficient? Joint use agreements are a policy or an approach that's been moving forward and being adopted in more communities, again, by which the school will not shut the doors once school's open, but leaving even the school gymnasium or the parks open for kids in the community to use after hours. Land use planning, there's been a large effort to integrate health into decision. There are opportunities in zoning policies to look at these issues. We wrote a paper a couple of years ago looking at zoning and health and how there are opportunities as you're writing zoning policies to integrate health and address inequities and disparities. That's in environmental justice, if you're interested. There's also opportunities to promote mixed income housing, and again, sustaining community economic development, which again gets back to what I talked about earlier with these inequities. And finally, addressing the social determinants of health, those underlying causes of health disparities related to education, income, housing, etc. I do a lot of work in health and all policies and health impact assessment, which has been shown to actually bring together sectors and to bring health to the table, particularly in these sectors outside of health that influence health. And for all of these strategies, I want to just emphasize we need to think about how all of them are being implemented. We need to think about unintended consequences related to inequities that could result. And also, I think it's important to continue to evaluate these efforts to make sure that we are achieving the changes that we're seeking. And for obesity prevention, I think it's important we want to get from here, right, and from here to here, where we have communities where people can walk, where kids can play in playgrounds, where people can bike safely, and where we have communities that are equitable, that are promote access to safe physical activity, and by which all people can benefit from opportunities to promote the public's health. So thank you for your time, and I look forward to some questions and discussion. Yes. Yes.
I was just curious if anyone did. You had talked about how living near a path increases physical activity or walkability. Has anyone looked at the distance? Or I'm assuming, what is the distance? You know, what is the
Yeah, that's a great question. So absolutely. So the question was, just to repeat it, is has anybody looked at distance to those paths that promote activity? Yes. And so we know that if people live half a mile, even up to a couple miles, by which they have a car or a bus to get to the paths, they're more likely to use it. So it's being near the path, but also having a way to get there. And so there is evidence supporting that if somebody lives 3, 4, 5 miles away and they don't have a car and there's not an easy bus route to get them to the paths, they're not going to go. But for people who have access to them, near can be anywhere from half a mile to 3, 4 miles away, by which you can get there. Yes, sir.
I have a question.
Sure.
It's going to sound like bike bashing. It's not.
Oh, okay.
I own a bike. I ride a bike, and some of my best friends ride bikes. But I think we have a problem in when we talk about policy about bikes versus walking trails. And I just wonder how that's playing out in Baltimore. In particular, I think the problem is as we push more and more bike lanes and biking trails, there's a lot of attention and resources spent taking people who are already physically active and making them more physically active. But I don't think there's very much evidence that somebody who's sedentary is going to jump into biking versus walking. Right? So I think from the public health point of view, we need relatively more attention on walking trails than bike lanes and bike trails. Now, obviously, in the best possible world, we would have both, right? But I just wonder how that's playing out in Baltimore. Do you see any trade-off or any tension for walking versus biking?
Yeah, thank you for that question. Absolutely. And I have a couple things to say. So after the work that we started doing on pedestrian safety, I was asked by the mayor to be on the Transportation Safety Task Force, where we focused on together pedestrians and bicyclists, and it was clear that the strategies are so different, and we ended up having more attention to the pedestrian side. And for this exact reason, I think people who are sedentary, we don't have good evidence about this, but we believe that they're more likely to walk than they are more likely to ride, because there's just a lot of barriers to people riding, right? People don't know how to ride, people don't own a bike, they don't have access to a bike. But this question is something that actually I have a project that we're in the field now, supported by the Johns Hopkins Urban Health Institute, where we're looking at biking, and we're looking at people who are riding, and we're looking at people who don't ride at all, to understand, would they ride? Why are they not riding? And what's coming up so far from our preliminary data are issues related to traffic and safety is the number one reason people are not riding. In terms of the bike lanes, in terms of the cars, there are also people that are very upset when bike lanes get put in, that they're losing parking. And so that's another issue that we're thinking about. And we're working with an advocacy group called Bike More, which is promoting biking, to say, let's think of what strategies might work well. And we're doing a survey and focus groups and key informant interviews with stakeholders around the city. Where the discussion now around biking is, it's around bike share. Bike share is coming to Baltimore. Apparently it's going to roll out this fall in the downtown area. And the concerns around bike share are related to access, and that there are communities in Baltimore which don't have a lot of public transportation options. And so if you put in a bike share location or station where you can get a bike or people going to use it, you actually have to have some way of setting up an account that's tied to a credit card. There are many people who don't actually have credit cards. So thinking through these barriers, I think, are what's coming to play in this urban environment in Baltimore. But I agree with you that somebody who's sedentary is more likely to walk than to ride, and we still don't know enough about people who are sedentary who might want to ride, and how do we get them to actually ride. So we're collecting some of that data right now. Yes, sir.
We have a state law in Colorado that the pedestrian has the right of way, but we have crosswalks, and sometimes they're lit and sometimes they're not lit, and they're very confusing. In other words, there's a button that people can push to make the light go on and off, so you know somebody's there. Have you had that experience?
Yes, it's a really great question. So when we first started our pedestrian safety campaign, we actually had we put up a banner that was from the other campus that said, "Pedestrians have the right of way, period." And the police said, that is wrong. Pedestrians don't have the right of way, period. That there are many instances where pedestrians should not be crossing, and that there are really clear rules where a pedestrian should not actually, in Maryland, should not step out into the crosswalk if the light is flashing. If the hand is flashing, you should not step out into the crosswalk, and that could be you can be ticketed for that offense. And so what we found is that people have this perception that pedestrians have the right of way, and that's part of what we're educating people about. We actually have our traffic safety officers about to give out these cards that actually have the traffic laws on the back for pedestrians, so that people are just more aware of what they can do, when they should cross and when they shouldn't cross. There are new signals being developed to help people cross. The countdown lights seem to be pretty effective, although people still run across the street after you have zero time, thinking, I have 2 more seconds to get there. And so I think we're sort of waiting to see how that plays out, by educating people that the countdown lights, 0, because that light's going to turn green immediately and those cars are going to start going through. But I think people are confused about, are they able to go or not go, or sort of the perception's incorrect on that.
Well, you have these signs that are yellow, but should the light be on all the time, or should it just be on when the people are crossing?
And are those the ones where you push the button and the light comes on? Yeah, so most places when you the pedestrian activates that light, and so they're not on until somebody's there to cross. And so that's, there's a transportation engineer's handbook that clearly spells out how all of these interventions should be implemented in the standards for them. But for that one, from what I've seen, the pedestrian activates them. There could be ones that say lit all the time. I'm not familiar with those, though. Thank you for the question. Yes, ma'am.
I'm just curious, when you're working with communities to try and change the built environment, what are some of the unintended consequences that surprise you expect?
Yeah, that's a great question. Thank you for the question with sort of what are unintended consequences that might have surprised the community with the changes. I think probably the Safe Routes to School is probably the best example of that, which involves money to actually make engineering changes in the community. And I think people didn't realize how unsafe the neighborhood was until they saw the changes. It was sort of like a little light bulb went off and you sort of thought, oh yeah, that sidewalk was not very well maintained at all. And I think once people see the after effects, they realize how poor things were up front. I think that's actually been surprising that people haven't seen that. Something else that I think is coming up that we're mindful of is the way Safe Routes to School is, the money is allocated is that people prioritize, or we could prioritize communities based on data, the most high risk intersections. And some of those are clearly low income neighborhoods, but there are also places where we wish, that are sort of in more affluent areas where a lot of kids are at risk. And so we focus on those areas, and people in low income areas are saying, hey, what about us? And so I think there's a challenge there to think about, are we creating more inequities by focusing on those areas of high risk while not also thinking about the areas where there's more need? And I think that's a challenge, particularly when the program is so underfunded and you're trying to target limited resources to keep the most kids safe that you can. Yes, sir.
Well, you mentioned that transportation engineers are kind of in a unique position because on the one hand they have the prerogative to keep traffic moving, and on the other hand they have some responsibilities for safety. And I was just curious, in your interactions with the transportation engineers you worked with, what sort of education happened in either direction? Do you feel like they began to see things from your perspective, and do you feel like they learned some things from that?
Thank you for that question. I'd like to say yes, that there was education on both sides. I'm of the mindset. I mean, I love what I love what New York City did in terms of no cars in downtown area, right? So I'm all about, let's just not have cars here, period, right? And so that's the worst thing I could say to a transportation engineer. But I think one of the things that was important in those discussions is that I had a better understanding of what they're looking at for traffic flow. And I can easily say, well, we need an arrow here. We need to stop traffic to let people go, understanding that actually has ripple effects. And so it helped me as a person who's not a transportation engineer to think through those issues. But I think we raised some of these considerations with them. And something that somebody said to me during one of these meetings with them was that the new generation of traffic engineers are sort of learning about these issues more. And so I think I'm optimistic that the folks coming out now and sort of over the next decade will have a greater appreciation for some of these issues related to the built environment and health. And I'm hopeful that things will continue to change and that considerations about safety and health will be part of those decisions that transportation engineers are making. And I think we as public health people can do a better job of giving them the tools and the resources they needed to make better decisions and also understanding how they make their decisions. Great. Thank you.
Thank you so much, everyone, for coming.
Thank you.
Just really quickly, please, if you didn't sign in yet, please sign in. And then we have a quick announcement.
Yeah, for those of you who are interested in hearing Keshia again, she'll be speaking again tomorrow in Etu North 1206 at noon. And her topic tomorrow is on injuries in Major League Baseball as an occupational health issue. So please come back for a second dose of Keshia.
Thank you. And feel free to grab another sandwich if you want. There's some leftovers, so grab some sandwich and some cuties.
Thank you so much. Is that all right?
Okay, great. Thank you.